Okay, good morning, everyone. Thank you for joining us. This is the fourth installment of our year-long 12-part series with BSAS to help you answer your medication questions. Our topic today is going to be medication rooms, how to set up your space for success. I am your presenter. My name is Allie Burns, and I am the president and CEO of EMO Health. I am also a registered pharmacist. So let's jump right into this. I don't have any financial interests or relationships to disclose. We want to give a special thanks to BSAS and, of course, the Massachusetts Department of Public Health for funding this initiative. Okay, medication rooms are very dynamic spaces. It's where medications are taken, stored, documented, and disposed of. Environmental factors, such as work interruptions, noise, and the physical layout of the space, impact patient safety and employee job satisfaction. Poorly designed medrooms can contribute to med errors, resident stress, employee burnout, and compliance problems. So today we're going to focus on the key features of a standard medroom and how to enhance the efficiency and safety of the medication taking process within that space. So what exactly are the key features of a medroom? Well, first, it should be secure. And by secure, that means it secures the medications from theft, pilferage, damage, spills, and anything else of that nature. It should be accessible. And this means accessible for all, so including our handicapped and disabled residents. It should be private, meaning it protects the residents' confidentiality and gives them a private space to inject medicines like insulin. Functional, utilize all your available space to properly store those medications, the medication refrigerator, and supplies such as counting trays. And finally, it should be clean and organized, free of clutter, noise, and distractions. Physical design and layout. Physical location. In an ideal world, I know that you would have just enough space, everyone would get their meds, and they would feel comfortable in it. But we know that that is not necessarily the reality, where most of us are working with just the space we have. And we're going to go through in this presentation how to really utilize that space best. So the medroom should be centrally located and should be in a visible area that is well lit. Preferably, it should be on the ground level or on a floor that is accessible by elevator or ramp. Place the medroom near the program entrance to reduce the amount of time and steps it takes to physically transport those medications to the medroom. This will reduce the risk of diversion. It must be temperature controlled. And by room temperature, that means between 68 and 77 degrees Fahrenheit. Just remember that spaces with high humidity or large swings in temperature can damage the medications. They are very sensitive to temp. And it should be definitely well ventilated. This is going to be important for any of those residents that are using inhaled medications, also known as inhalers. You want to avoid certain places, and this first and foremost would be high foot traffic areas. When you're in a high foot traffic area, it's more likely to be chaotic, and it can jeopardize privacy and security. It can also cause crowding, which that wouldn't be good in the case of an emergency such as a fire or something else. You really don't want crowding around the medroom. You also want to avoid placing it near any type of staff break room or resident rooms where personal belongings or bags are kept. When it's placed near one of these locations, people may overhear very private conversation and medications. You want to avoid placing the medroom near the kitchen, cafeteria, or mail delivery area. And the reason for this is this will help prevent med lines and medication deliveries from being mixed up with food lines and package deliveries. It also will decrease the amount of distractions and noise. It's very important for your medroom to be functional. And by functional, what I mean is staff should have positive control over the space, and they should feel like they have the tools they need to get their job done. And it should also be inviting, meaning the resident should feel comfortable and safe taking their medications in there. Staff should have an unobstructed view of the residents as they take their medications. You want to avoid setting up the room in any way that causes the employee to turn their back to the resident, and you want to keep those important items within arm's length. Place the trash away from the tabletop where the medications are being taken to prevent any pills from accidentally falling inside the can. The countertop or table where medications are taken should be 15 to 48 inches high. That is actually an ADA standard. Make sure it's flat and dark colored so pills can easily be seen. The vast majority of pills are white or light colored, so a dark color is going to allow you to see the pill in case it does fall. You want to avoid using desks or other types of furniture with drawers, cubbies, or other sorts of nooks and crannies where pills can be, hidden or fall into. Streamlined, minimalist furniture is recommended. You want to avoid wood and other porous surfaces. Plastic, metal, or hard surfaces are preferred because these can be disinfected easily. If the countertop does contain a sink, place a mat or covering over that sink during med hours. This is going to reduce that risk of the medicine being lost down the drain or damaged by water. Okay, ADA, I just mentioned it, but we're going to go into a little bit more detail about this. So there is part of the regulations, there is a non-discrimination and accommodation section where the program space, and that includes any satellites and medication units used for patients or residents, shall be accessible to individuals with disabilities and shall comply with all federal, state, and local requirements for accessibility. Now, I don't expect anyone to know this off the top of their head, so I'm going to explain what this means. The physical dimensions of your space must comply with the Americans with Disabilities Act, the ADA. The ADA defines the requirements that are related to space allowance and reach ranges. So when I was talking about that 15 to 48 inches high, that's part of the required reach range. The space required for a wheelchair to make a 180-degree turn, so turn around once, is a clear space of 60 inches, so about 5 feet. If a resident with limited mobility isn't taking their medications, it might not be because they don't want to take the medication. Ask them if they're able to get into and get to that med room unassisted, because if they're not, that could be part of the problem. Now, this is a very, very rough draft of what a med room may look like. I want to point your attention to that right corner of the room. You see the individual in the wheelchair, and that's 60 inches by 60 inches. You need a full turn radius there of that 5 feet so someone can actually turn around fully in a wheelchair. As you can see in our med room here, the staff has a clear view. The staff member, by the way, is the person standing by what looks like lockers. Those are medication lockers. And the patient is the person sitting at the desk. So here the staff has a clear view of both the medication storage, which is those scalable lockers, and the medication taking area, which is that tabletop where the patient is sitting. The medications and the medication storage is away from the windows, direct sunlight, any heaters or air conditioners. So as you can see, we have a window in the room, and those med lockers, nothing's placed up against that window. Again, with a window, you have the opportunity for water to come in. It can expose the medications to sunlight, which would deactivate them, or any type of change in temperature. Again, we want to keep the storage and the meds themselves away from that. It needs to be a very controlled, stable temperature environment. On the left side, this is a small med room. We have our sharps container that we mounted above our confidential trash. And then right above that, you can see we have some overhead cabinets and shelving, which we are using to maximize the space. So how do you really utilize small spaces? Think vertically. I want you to take advantage of any wall shelving, overhead cabinets, stackable furniture, stackable containers. You're not going to be able to expand the actual, space across the floor, but use everything you can from floor to ceiling. Use all of the wall space. Mount objects where possible. Make sure that they're also safe to mount. Some objects that can be mounted, sharps containers can be mounted. If you use RX Destroyer, any of the other activation solutions to dispose of medications. Those can be mounted. Those are just a few examples. You can also get nesting chairs or stools that can be stored underneath the table or countertop when they're not being used. Again, that's going to create clear space if you have someone who is disabled or handicapped. And it doesn't just mean with a wheelchair. I mean, you could have someone who's on crutches, who uses a cane, who uses a walker. All of these issues, will limit someone's mobility and make them less comfortable to come in to take their medications. You want to replace any big clunky furniture with functional multi-purpose furniture such as corner desks or expandable tables. Here's a hint. If you're looking for furniture, you can Google the big buzzwords like space-saving furniture or cubicle furniture. This can help you utilize your small spaces best. Shared spaces. So we know, like I said, in an ideal world, everyone would have the perfect size bedroom. It would be free of distractions. There would be no lines, and it would be a standalone space. But we do know that that's not reality. A bedroom is considered a shared space if it's used for any other purpose or activity other than medication taking or medication storage. For example, if you have your program's fax machine or printer stored in the bedroom, it's a shared space. Shared space must comply with all BSAS, ADA, and patient privacy regulations. Here are two important regulations I want to point out that are part of BSAS. Each building is required to have sufficient and separate space for reception and office areas. So do not use the bedroom as an office or as a regular office or as a reception area. And each building shall have adequate space for storage of equipment and office supplies. So of course, sometimes you do have a printer in there, there's just not enough space, but do make sure that it is your space of last resort. If you are putting that fax machine or printer in there, again, we don't want to jeopardize the security of the room, and we do want to protect our patient's privacy. Shared space must be free of clutter, and it must provide similar or a comparable level of security and patient privacy as a standalone bedroom. Space for medication activities must be clearly separate, for example, on the other side of the room. Designate specific hours when the shared space can only be used for medication taking. At this time, all of those other activities must stop and staff must vacate the space. Shared spaces do increase the risk of diversion, med errors, and breaches of patient confidentiality. However, like I said, we do know that sometimes it is a shared space. These are a few things that it really shouldn't be shared with. So bedrooms should not be used for any of the following. It should not be a storage space for employee belongings, including their lunches, purses, or backpacks. It should not be a storage space for personal belongings that are left behind by residents. It is not a storage space for cleaning supplies or other toxic substances. It is not a place for employee meetings, phone calls, resident groups, or individual counseling. And it is not a place where you can have any activity that you think will disrupt or make taking medications unsafe. When you are utilizing the space and it is shared, you may need additional security measures to protect medications and privacy. You're also most likely going to need additional policies and procedures to address those unique challenges of a shared space. So for example, having an annual employee training on how to limit distractions and interruptions within the shared space. Okay, audience participation. What is the difference between a kitchen refrigerator and a medication refrigerator? A, kitchen refrigerators contain food, medication refrigerators do not. B, medication refrigerators should not contain freezers. C, both A and B, or D, no difference. And you guys can use the chat box to enter your answers. I'm going to give you a minute. Okay, so the correct answer for this is C, both A and B, which most of you had C, which is great. So the med refrigerator must be located in the med room. That is part of BSAS regulations. No food at any time. Even if you guys don't have meds in there, make sure you don't have food in there. The only acceptable food is actually if a resident is prescribed Ensure or in one of the other dietary supplements to support their nutrition. This does sometimes happen. That type of prescribed food is allowed in the fridge, but no other food and no drinks, not even water. No freezer. Okay, why? Medications that require refrigeration must be kept at a stable temperature between 36 to 46 degrees Fahrenheit. Believe it or not, I know a 10-degree shift, if this was us and it was outside, we would certainly know the difference between 36 and 46 degrees. But for medications, this is a pretty narrow range. Fridges with the built-in freezers, they have unequal temperatures throughout. So what I mean by this is it's actually colder closer to that freezer, and the freezer is usually near that top shelf. And this can damage medication and make it less effective. So here are some examples. On the right side of the screen, you'll see the medications that are stored close to that freezer are going to be near freezing temperatures. So we do not want something with a built-in freezer. But if you look on the left side of your screen, you can see the freezer is either physically separate or there's no freezer at all. And this will allow the medications to stay within that correct temperature range. Med refrigerators. So as you can see, I highlighted what a refrigerator thermometer looks like, and see how tiny that refrigerator range is. I know it does, it seems like the 10 degrees is a lot. It's very narrow in the grand scheme of things. So if you're worried about the temperature in the fridge, one of the best practices you can do is you can get a refrigerator thermometer. These cost anywhere from $5 to $15. They can be purchased at major retailers like Amazon and Target. A good idea is to assign an employee or a shift that will regularly check the temperature once a day and record it on a temp log. My suggestion was potentially you could have the third shift do it. So overnights, make it a duty for them. And this way, as soon as someone comes in the morning, they're going to let them know the fridge is out of temp, the temperature is out of range, and we need to look into that. If you're checking it and it's the second shift, you really can't do much about it overnight, right? So if the most likely, whenever you want to pick a time of day, one where it's going to be consistently done, not interrupt other duties, not interrupt medication taking activities, and where you can actually act if it is out of range. So my suggestion would be consider that third shift. Make sure your refrigerator is connected to a generator or a backup power source in case your facility loses electricity. Again, if you lose power, it's going to compromise the integrity of those medications. And if you do have a refrigeration mishap, which does happen, call the local pharmacy. You can ask the pharmacist if the medication can still be used. Let them know the facts. We think that it's been out of refrigerated temp for so many minutes or hours. Ask them, is it still safe to be used? And then you can also ask them, can you help me get a new undamaged product? Sharps container, very, very important. Have a Sharps container on hand. Even if you do not have a resident right now who injects medications, at any single point on any day, a resident can be admitted who uses injectable medications, lancets, or finger sticks. Many diabetics use finger sticks. All of these are Sharps, and the day they show up, they can't wait for the Sharps container the next day. Especially if you have someone testing multiple times a day, you need to have that Sharps container right then and there. And it's going to be very hard for you to drop everything and find one. So have a Sharps container on hand. Where to get them? So you can order them from medical supply stores. There are select pharmacies that have them, and you can actually get them at major online retailers like Amazon. If you put Sharps container into Google search, you will have a whole host of sites that will come up. Where to dispose of? Okay, so we do know that in Massachusetts, there is a regulation, there's a sanitary code right there. Sharps cannot be disposed of in the household trash. Improper disposal can lead to a very large fine and up to 2 years in the House of Corrections. But here are some options. You can do a mailback service, which on the next slide, I have 3 examples. This type of service is where you actually, once that Sharps container becomes full, you mail it back to them and they dispose of it. You can also dispose of sharps at syringe services programs, so SSPs, or any authorized drop-off site in Massachusetts. Many of these include the local health department. You can also go and search by zip code at safeneedledisposal.org. Mass.gov does have an updated list. It is from 2019, but it does have a list of authorized drop-off sites in the state, and there are some of the medical mailback services for you. Okay, clean water, very important. Many of our medications do need to be taken with a full glass of water, 8 ounces of water. Programs are responsible for providing their patients with a clean source of water in the med room. So what I would say is maximize your space. You consider a countertop water dispenser. You can do bottled water if you prefer, a filtered pitcher. There are many options. I would also provide them disposable cups. It will be a compliance violation. It can also be a safety issue if you have patients that are leaving the med room with their medications in hand to get water. Please make sure that you are providing them with clean water in the med room so they are able to take their medications. Med room supplies. Okay, the med room should be stocked with all the supplies that are needed to support the safe use of medications. The main ones here are going to be your counting trays, pill cutters, and scissors to cut medication patches or medication films like Suboxone. You do not need fancy scissors. You can use normal scissors, but I would definitely make these scissors, for example, a bright color. Sometimes I recommend get a pair of scissors with an orange handle, and for orange Suboxone films, keep that in the med room. Make sure everybody knows the orange scissors, they stay in the med room. They're just for medications. These are, not a must have, but a nice to have. So sometimes it is nice to have that emergency eye and face wash station. Sometimes people have it in the kitchen area, in the cafeteria. They have it other places in the program. This is going to be useful if you do have an irritating medicine or chemical that gets into someone's eye. Average price of these is about $40. These are mountable on the wall, a safe space. And another nice to have is a blood-borne pathogen or bodily fluid cleanup kit. These are going to be used to clean up any blood, any vomit, any type of bodily fluid that gets on the floor. They're about $15 to $20, and you can get them at major retailers like Amazon. Okay, keeping the med room clean. How often should you clean the med room? Well, you need to regularly clean it to make sure that it's sanitary. And this means vacuuming or sweeping at least once weekly and disposing of any of those found pills per your program's policy. You want to clean the table or countertop where the medications are actually taken once daily with the appropriate disinfectant. You want to store all household cleaning products outside the med room. Poisonous chemicals should not be kept near anything that is taken by mouth. I would also consider assigning this again to a very specific employee or shift. If you use the third shift, that is again going to minimize those disruptions of medication taking during the day. Do not forget about the counting trays and spatulas. So as you can see on the right side of the screen, there is the counting tray. The item that looks almost like a knife, that's called a spatula. These should be cleaned at least once weekly. Pill cutters and scissors, they can be cleaned as needed as they become sticky or coated in any powder from pills. How do you clean these? All right, believe it or not, and I know you're gonna have to lock this up because alcohol is not, just allowed to be left out in the program. But the way to clean these is you clean them with 70% isopropyl alcohol, also known as rubbing alcohol. Let it air dry. Do not rinse it with water. Do not use any toxic or poisonous cleaners like Clorox. Those cannot be ingested. Do not wipe. Do not pat dry. Rubbing alcohol, let it air dry. A lot of people have allergies to penicillin and sulfa medications. Your main sulfa medication that you're going to see is Bactrim. These medications should really be counted on a separate tray and a separate spatula. If they are counted on the same tray and someone does have a very severe allergy to penicillin or sulfa, they can have an allergic reaction. So what I would suggest is getting 2 different colored spatulas and trays. Label one as sulfa only and one as penicillin only. And those should be separate from the one that you use for all your other medications. If you don't have any other trays, if you only have one spatula, then really you should be cleaning that daily, because again, you do not want that cross-contamination with the penicillin and sulfa medications. Organizing workflow and avoiding long lines. The best thing you can do with any med room is organize that medication taking process. Ask the staff who are actually working in the med room, hey, what is working and what's not? Use that staff feedback to improve your current procedures. They have all the insight on it. And you can also ask your patients what's working and what's not, and use their feedback as well. Any type of unnecessary interruption or distraction is going to increase the risk of a med error occurring. When staff are doing meds, they're only doing meds. There shouldn't be any extra people in the med room, and casual conversations should be limited or none at all. Set clear expectations and be consistent with your residents. So what I mean by this is make sure they know what is the expectation, how are medications taken at your program, when should they come to take their medication, what are the hours. What I would suggest is creating a medication orientation video and or an orientation handout for your residents. That means so every time a resident comes in, they're given the same exact information in the same exact manner. They're going to know this is the expectation and this is what is expected to me of taking meds here. Designated medication hours and times. So if you don't have times already, it will organize the medication taking process if you establish designated times in the morning, noon, evening, and bedtime for residents to take those meds. This is not only going to provide structure for your staff, it's going to help the residents remember to take their meds on time by creating a medication taking routine. Having less than 4 medication times per day is clinically inappropriate. For example, certain antibiotics need to be taken 6 hours apart to work correctly. You cannot, take 2 at once. You can't double up on these medications. There's other medications that need to be taken with food or with meals to actually be absorbed in the body. And there's other medications that have side effects, for example, sedating side effects, and they really need to be taken closer to bedtime. Having someone take it earlier in the evening may decrease their program engagement and participation simply because that is the side effect of the medication. So make sure you have 4 distinct times during the day for patients to take medications. If you do have a resident that repeatedly misses med hours or is trying to take their medications outside of those designated hours, notify your supervisor and the treatment team. You're going to have to really look at the why. Why is the person missing the med hours? Are they not managing their time well? So look at those time management skills, consider a medication support plan, look at all of the reasons why, and then move forward from there. Okay, long lines and wait times. This is an issue almost at every location. So if it's happening at your program, you are not alone. Here are some tips and tricks. Long lines, we know that it can trigger anxiety in people, and it can lead to medication non-adherence. They'd rather not take the meds than wait in line. So what do we have to do? Let's proactively prevent those long lines and wait times. You can use a take a number system. You can use a sign-up sheet. Call residents down by room number or by floor, not by resident name, but by room number or floor. You could consider extending medication hours. You can use 2 medication lines. So what I mean by that is 2 employees observing meds at the busiest times. And we're going to show you how to turn one space into 2 in a few slides. You could create a comfortable waiting area for them. If residents are skipping medications due to long waits, the program really needs to evaluate the process ASAP. If someone's skipping a medication, for example, if you are skipping a mood stabilizer or an antidepressant or any medication for that matter, there is a very high risk that that patient will destabilize and relapse or leave treatment. Privacy and patient confidentiality. So it is part of the regs. All the program service areas shall be designated and furnished in a manner that is consistent with their use, and so as to safeguard client confidentiality, dignity, and privacy. A resident's medication and health information is protected under HIPAA. In addition to HIPAA, there are a few things that have extra protections under state and federal laws. This includes the treatment of substance use disorders. Those are protected under 42 CFR Part 2. Anyone's mental health history, diagnosis, or treatment, any HIV or AIDS testing, diagnosis, or treatment, and any medical and surgical history, such as gender confirming surgeries. These all have extra protections. Please remember that if someone is not a medical provider and reveals someone's HIV status to others, Massachusetts general privacy laws takes this very serious, and it is cause of action to sue. There is a lot of information about privacy rights if you do go to mass.gov or hhs.gov, so hotel.sierra.gov. To put it in perspective, already this year, between January 1st and March 31st of 2021, there have been $5.5 million in HIPAA fines. So please make sure that you are protecting privacy and confidentiality. Programs and individual employees can face up to a $50,000 fine per violation, even if the information was disclosed accidentally or unintentional. So please make sure you are protecting confidentiality. Use quiet indoor voices. Never yell out the name of someone's medication. Even if the resident starts the conversation with you, never discuss their medications in front of others or in any sort of public area, such as a lobby, elevator, or cafeteria. Tell the resident, hold on, and take them to a private office or space to continue that convo in private. Always keep the doors of medication cabinets or lockers closed. Only retrieve the medication for the resident in front of you. Don't pre-retrieve any medications for the next person in line. Make sure all those medications from the first resident are put away before that second person enters. Use opaque or dark colored storage bins so people cannot see into those plastic containers. Seeing another resident's medication or medication records is considered a breach of privacy. So you want to make sure you put those medications away as soon as reasonably possible when they're dropped off either by the patient or by a pharmacy that's making a delivery. You never want to leave your shift without putting those medications away. Never leave a medication bottle or blister pack out. Never leave a medication record, such as a MAR, tracking sheet, a binder, or folder out. Make sure that you have a confidential trash or shredder in the med room. And always black out personal health information like the resident's name and prescription number before throwing out a prescription bottle, blister pack, or taking any of those medications off-site to be disposed of. Okay, so I did talk about 2 lines. There is part of the regulations that says medications may not be provided to any other resident if residents are in the storage or office area. The purpose of this section of the regulations is to protect patient privacy. However, it can contribute to long waits, frustrated residents, and very burnt out staff. So how do we deal with this? Here's a perfect example. Sometimes we don't realize how long meds would take. If you are a program and you have 20 beds and each resident only takes 3 minutes to take their meds, you're going to need at least 1 full hour of dedicated time each time that medications are observed during the day. So if it's done 4 times, you're going to need at least 4 hours. Now that doesn't include, maybe it takes them 30 seconds to walk from the med room and to the med room. That's another minute. now times 20. It's very easy to go beyond a full hour when you have 20 beds or more, even if they are taking their meds rather quickly. And we don't want to rush the process either, because we don't want to open it up to mistakes. Good news is there are many places that have also dealt with this issue. Hospital clinics and pharmacies have dealt with this problem for a long time, and they've created some interesting solutions. So you could turn one room into 2 private spaces to take medications, and there's a couple ways to do this. You can use medical room dividers, you can use hush panels, you can use a Dutch door with a ledge, or drive-up style medication windows. And what you would do is you would have 2 staff members, 1 in each space, for med observation. You couldn't have one person watching someone in the medication room and watching them at the window, for example. You couldn't have one person watching 2 different people on 2 different sides of like the divider. You would need 2 staff members for this. I do realize that, it is, the staffing pattern is what it is. So what I would suggest, if you are dealing with very long lines and you notice, okay, everyone is leaving in the morning around 7 o'clock, and between 7 and 8, it is just absolute chaos. Or you notice when everyone comes home in the evening between 5 and 6, again, it's absolute chaos with the meds. You could designate 2 staff people at those specific times to help support the lines. You wouldn't need 2 staff members all the time or even every day. Just notice which times and days are most chaotic or need the most support and work around that. Bedroom security. So you want it to be easy to access, but have limited access. The bedroom should always be locked and never left unattended. You can consider using security or corner mirrors. So those mirrors that are placed in the corner of the room where you can see down, you can see what people are doing. You could use security cameras. You could use motion detecting lights, and this would help you monitor your activity in and around the bedroom. You want to be looking both inside. So you want these security measures to be pointed at areas where medications are both stored and taken, and outside. So point it at the door where people enter and exit. If you suspect a resident or staff diversion, notify a supervisor immediately. Do not wait. Make sure that all medications are locked up, and I really mean all of them. So all the prescription medications, all the over-the-counter OTCs, any medications that are provided by the program, such as Advil or Tylenol, and medications that have been discontinued, expired, or left behind by a resident. All of these need to be locked up. The exception is residents can keep medications on them that are used to treat emergencies. So an EpiPen, a rescue inhaler, nitrostat, which is used for very severe chest pain, which also often comes before a heart attack. Narcan is another emergency medication. And then any type of medication that needs to be applied in private because it's used on the genitals or the genital area. So think of things like enema, suppositories, Monistat, those types of medications the resident can keep on them or in their room. The program must document every single medication and the quantity that remains in the resident's possession, and that has to be an accurate document. Storing medications in any of the following ways is going to limit the security, increase the risk of a med error occurring, and potentially violate patient privacy laws. So avoid putting medications belonging to multiple patients in the same container or plastic bin. Again, if a resident sees another resident's medication, that's a violation. You want to avoid putting all controlled substances of one type together. So if you're taking everyone's Suboxone and storing it in the same bin, you probably want to rethink that. The best practice is to keep all medications belonging to one resident in one place, meaning in one container, one bin, or one locker. Here are our takeaway points. So you want to maximize your usable space, the accessibility and security of the room. You want to minimize any diversion, distractions, or breaches of confidentiality. Make sure you have those appropriate medroom supplies, such as the Sharps container, the appropriate refrigerator, and make sure you have these before the resident arrives with an injectable or refrigerated med. proactively address those long lines and train your staff on de-escalation to decrease stress and improve medication adherence. And remember, having a med room with a good physical design and efficient workflow will decrease medication errors and improve both resident and employee satisfaction. If you have any questions, we're going to open it up in a minute for that. We are also going to have our normal congregate care call this Thursday, April 15th from 9 to 10 a.m.